Welcome back, our viewers, and it's truly important how video games should be managed and exactly should be managed by the parents and by everyone to take the full benefits of it. So for now, breast cancer remains one of the most common health challenges among women, but thanks to scientific advancements and modern medical technology, recovery rates have increased significantly in the recent years. At the importance of early detection, today's advanced screening tools such as mammography have become essential for identifying the changes long before the symptoms appear. In this interview, our viewers, we highlight the role of regular screening and innovative technologies in protecting women's health. So please, welcome with us Dr. Nadia, Aleisa, consultant breast imaging. So, doctor, thank you for being with us at Good Morning Kuwait, and of course, good morning to you.
Good morning.
Good morning. And of course, so for the first question for today, and it is really important for everyone, why is mammography is considered as the gold standard for early breast cancer detection?
All the international studies have shown mortality reduction by approximately 40% in women with breast cancer. Now, when we compare to other modalities, which is happening every day, by the way, patients will come, they will pick ultrasound, for example.
Mostly, yes.
Yes, ultrasound, and they're thinking because there's no radiation, it is efficient, and it's replacing mammogram exam. That's not true. Now, if you have, for example, a lady who's 40 and above, mammogram should be the first modality to look for breast cancer.
Why is that exactly?
Mammogram will show microcalcifications, which is the stage, we call it stage 0.
Okay.
So there's no tumor, there's no invasion, it's only microcalcifications. And this is the stage where we want to pick up cancer, actually.
That's the earliest one?
The earliest, and the mortality is really low. The 5-year survival rate is more than 98%. It's reaching 100% almost. You see?
That's great, actually, yes.
Yeah. Now, breast ultrasound will not pick up microcalcifications.
So it will go on a more advanced stages, which we don't want to be at.
Yes, exactly. Now, some patients, they will say, I have no family history.
Okay.
So I don't need to do a mammogram. Or, I have no symptoms. I don't need to do mammogram. Well, 75% of women, they have no family history of breast cancer. Just being a female and getting older, both are risk factors for breast cancer. Now, what's about men? Do they get breast cancer?
I believe not. We didn't hear that before.
Yes, they do, but the percentage is very low, less than 1%.
Okay, that's great, but I believe so after that we should also have a mammogram.
No, not really, because the risk is very low, but any male patient who's feeling a lump or changes in the breast should go to the clinician and to do, for example, breast ultrasound, sometimes mammogram.
Okay, so is that make it also essential even for men who have some kind of symptoms, like what you just mentioned, for them to be checked out?
Sure, yes, they have to, actually, because although it's not common to have breast cancer in men, but there's still a chance of having it.
Less than 1%, but also it's there. I mean, it's not impossible.
Yes, and I have seen male patients with breast cancer, and we did mammogram for them at that time and biopsy.
All the hope for them, and all the hope for everyone to get well for any type of sickness. So, since we're talking about the mammogram, how is exactly the mammography considered and safe compared to ultrasounds, MRI, and how does the breast cancer detection, how is the accuracy with it?
Okay, that's a really good question. Now, the stage, as I mentioned earlier, we want to pick up the patient when she is not symptomatic. We don't want patient with a lump. We don't want patient with breast changes. We want it when she doesn't feel anything. Now, there are many studies, they show the sensitivity of the mammogram and breast ultrasound, breast MRI.
Okay.
The breast ultrasound, it's operator dependent, meaning if someone has an experience in breast ultrasound exams and doing it for a long time, then they can pick up small cancer, but not microcalcifications.
Which is smaller or bigger than small cancer cells?
No, it will be smaller, and it will be picked up not even by breast MRI when there is no invasion. It's only DCIS, we call this, or ductal carcinoma in situ. It will be picked up only by mammogram. And nowadays, it's not only one modality mammogram. We have 3D mammogram.
Yes.
Or 3D mammogram or tomosynthesis. What is the difference now?
You're asking me. I wish if I can know that. If I can.
So, I'm just saying that, okay,
Yes.
the 2D, it's static image.
Okay.
So you cannot scroll through the breast. So you cannot see different layers of the breast. 3D mammogram,
Yes.
it's 1 millimeter, the slice thickness. So you can scroll through the breast to look for any tiny tumor. That's why this is more accurate than 2D mammogram.
So that's a great development. So how long it's been here in Kuwait, the mammography technology?
It has been for a long time.
For a long time?
Yeah, for a long time.
Why did no one ever have the awareness about it? Because people still taking other detection tools.
Yeah, that's a great question, actually. The month of awareness, every year is...
Every October.
Exactly.
Yes. I'm aware of that.
What's about the 11 months, the remaining of the year? Nobody is talking about it, right?
Unfortunately.
Yes. So all the women, they remember, oh, this is the month of awareness. I have to go and do mammogram. If she is not coming that month, then she said, okay, I will wait for next year to do it. No, you don't have to wait. You still have 11 months. You can do it. So you don't have to wait for October to go and do the mammogram.
But maybe they will for October because it has mostly discounts for these detection
maybe.
tools. Yeah.
Yes.
So it will be a great initiative for that. So I will wait for October. But yet, any possibility of detecting or having breast cancer may, God forbid, for everyone not to have it, is that at any time they should have the checkups. And
yeah, of course.
Mammogram, I believe, it's one of the most remarkable tools for detecting it.
Yes.
Since stage 0, as you mentioned.
Yes, that's right. So now the mammogram, it should be every year, according to the American College of Radiology recommendation, starting from the age of 40. But can we start it earlier?
Yes.
The answer is yes, because some families, they have BRCA genes mutation.
Genes mutations?
Yes. So
okay.
that means they have a higher risk of having breast cancer at a younger age. Okay. So they should start at the age of 30 doing mammogram.
30?
When they have BRCA1 or BRCA2 mutation.
Okay.
Or first degree female relative at a younger age. For example, diagnosed with at the age of 42, 10 years younger, they should start the screening mammogram, but not before 30.
Not before 30.
Yes.
So that's exactly for the question that I was going to ask you about, because I was going to ask you at what age exactly you should advise for that. But yet, since we have the mammogram and compared to ultrasound, MRI, and other screening tools, are there any risks from having the mammogram?
Actually, there is no risk. Nowadays, the machines, radiation, the amount of radiation dose is very low.
Yes.
Okay, we have the mobile phones with us all the time.
All the time.
Okay. We go to the dentist, right?
Yes.
When we have problems, and
every
the radiation,
few months, yes.
yeah, the radiation dose is higher for X-ray machines.
Yes.
There.
The microwave at your home?
Okay, exactly.
Yes.
And there is a natural radiation from the ground as
yes,
well.
Exactly.
So flying, by plane, traveling by plane, long
distance. Going by a car. Yes.
So there's always a radiation, and this radiation, it's really slim. We shouldn't even think about it. And one of the stories I will tell you that every day I have patients complaining of radiation. Okay, based on what? Oh, I heard someone in the social media. That's the problem.
The problem is that we hear everyone from social media, like, do they have the certificates
No.
and the will to say these things?
No.
No, they have not.
No, they are just looking for a trend. Okay.
Exactly.
Yeah, and this
Scaring
is
mothers mostly.
True.
Yeah,
so
and
this
fathers.
is what is happening, unfortunately, and people like the comfort zone. They like to follow this because yes, I like it.
Yeah.
This is what is in my mind. So yeah, they are right. So
It seems safe.
yes,
Yes.
Exactly. But every day I have to sit with a patient, explain that, believe me, first of all, the radiation dose is very low. Secondly, this is a short exam. Within 5 minutes you are done and immediately you will get the result. And most of the time it's negative. So don't think about the bad negative thoughts. No, you have to be positive. I'm fine, nothing. And even though if you have no symptoms and there is something suspicious,
There is something, yeah, suspicious,
then it's still an early stage because you don't complain of anything. You're asymptomatic.
I believe, since you mentioned at the age 30, that every woman at the age 30 should have a mammogram every year in October, especially when there is like discounts or something. So, but if I wanted to ask you about...
Can I stop you here?
Yes,
because,
please.
Yeah, 30, there's certain criteria for those patients.
Yes.
So not everyone.
Not everyone should have every year screening.
At the age of 40.
At the age of 40.
Yeah, except when they have a high risk. First degree female relative, or BRCA genes mutation, or previous radiation to the chest due to lymphoma, treated lymphoma. So there are certain criteria.
Yes.
And this is the breast radiologist who can decide when you should start, or when the patient should start the screening.
So exactly how early detection contributing to reducing the mortality and improving the healing process for the breast detection?
Yeah, it's improving actually the quality of life as well. When a patient is coming and she's asymptomatic, like stage 0 or 1, the 5 years survival rate is more than 98%, almost 100%. But when she's coming late,
that's great, yes.
Some patients, she fears a lump. She will ignore the lump. 2 years, 3 years, when it's no more she can wait, she will go for mammogram eventually.
I believe the mammogram will be too late for this stage.
Exactly.
Yes.
And then there is like metastasis everywhere in the body, you know?
Yes.
She didn't come when it's treatable, curable. It's too late, unfortunately. Now, the 5-year survival rate for those patients, when they're coming really late with distant metastasis, it drops to 25%.
25%?
From 100% to 25%.
And before the 5 years, like from stage 1 or stage 0,
this
they can
is
have
almost 100%.
Almost 100%.
Yeah, almost.
So, you mentioned something, which is that sometimes they can have breast cancer not from, there's no family history for that.
Yes.
And no relatives at all.
75% of
75%. And you said at the age 40, they they don't need to every year to have a screening.
No, they have to.
They have to from age 40. Why not earlier?
Well, because no studies proved the value of starting earlier.
Yes.
But if you, because always there has to be a scientific based or study on large population, so they can say, yes, it's safe to start earlier.
Yes, like for the detection rate, yes.
Yes, but this studies, unfortunately, it hasn't been done yet. But some families, yes, they have breast cancer at an early age, like in their 30s, and they start at the age of 35 or 36. It depends on their family history.
Yes.
So, why not to start? We need to do studies, actually.
We need to, definitely. So can I ask you one question? What are the most symptoms that we can have? I mean, first, how many stages we have on the breast cancer?
Okay, we have stage 0, 1, 2, 3, 4.
1, 2, 3, 4, yes.
and 0, which is like ductal carcinoma in situ, microcalcification. nothing.
Only mammogram can show it.
Yes, exactly.
Yes.
And now when you start to have symptoms, when the patient starts to have
Yes,
symptoms.
I was going to ask you about the symptoms. Yeah.
Yes.
You detect this question.
Yes. So skin changes,
Okay.
like discoloration, ulceration of the skin, nipple changes,
From
bloody
stage 1?
discharge. No, this is will be the tumor is there.
Okay.
Yeah. When the patient's starting to have symptoms, it's no longer 0. Okay, that one is
Either 1
yeah.
or 2.
Yeah. And sometimes the patients, although she's an early stage, she's feeling a tiny lump because the location is superficial, so she can feel it, although it's less than 1 centimeter. You see how, but still it will be picked up by mammogram. And those patients nowadays, we will do contrast enhanced mammogram. And this is a new technology, actually.
Yes.
The sensitivity, it's equivalent to breast MRI.
Okay.
This doesn't take long time. In 8 minutes, the patient is done. Okay, it's a mammogram, but with contrast injection.
So it's like MRI, but kind of better and quicker.
Quicker, it's,
Yes.
yeah. You know, MR, it will take around 30 minutes, patient in prone position.
Yes.
This one, no, the patient, the usual mammogram, standing and quick, and, you know, every view will take around 4 seconds. So in 5 minutes, maximum 9 minutes for delayed images, she's done.
She's done, definitely.
And it is diagnostic.
So, as we mentioned all of these things, what are the most common misconceptions that women believe have the mammography have for this tool?
Thank
exactly?
you, Abdulatif, for asking this question.
You're welcome. Yeah, we needed to keep it for last.
Yeah. So those patients, she will say, I eat healthy food, I go to the gym every day, I have a healthy lifestyle. I don't need to go and do a mammogram.
Yes.
It still happens. It reduces the risk, but doesn't prevent it. And I have seen it in young patients.
Yes.
This is one of the misconceptions.
And there are also, I believe, many misconceptions.
Yes, the others will be, I have no family history at all, so I don't need to go and do mammogram.
And as you mentioned, 75% is the rate that they could have it
Absolutely
after age
right.
40.
Yes, exactly. Yes. The other one will say, I have done mammogram for a few years and I never got anything, so I don't need to do it anymore.
Yes.
That's not true. The more you get older, the higher the chance to get breast cancer.
So I believe that we can conclude today's interview with advising every woman, and now even for men, there are the percentage, less than 1%, but yet it's there. For everyone, they need to have regular checkups for breast cancer,
yes.
and for anything that they can have, God forbid. Dr. Nadia, Aleisa, thank you for being with us.
Thank you, Abdulatif.
You're welcome. Sharing your smiles and your expertise, I believe it's very important, so thank you for everything.
It's a pleasure. Thank you.
The pleasure is ours. For you, our viewers, that was Dr. Nadia, Aleisa, consultant to breast imaging. I believe now we'll go on a break and then we'll be right back, so stay tuned.